voice there of the mighty Lingo, and some very helpful tips about eye care, what you should do and what you should not do. And this ushers in the program, taking care of your eyes, eye health, eye business. For the next hour or so, we invite you to stay with us on this special frequency, Mended Studios, live stream platform. And as I indicated, we're going to be talking about eye health and eye care. My name is Bawani Prasad, and this is an initiative of PAVI, Persons Associated with Visual Impairment, the Trinidad Eye Hospital, and CVRS, and of course, Mended Studios. It's a partnership initiative, so we are looking forward to not only this program, but other programs in the future as we continue to bring to you information, education, and a little bit of entertainment as well. Today's program will be focusing on low vision, and you, our listeners/viewers, do have the chance to call us towards the end of the program. Now, I should caution that when you call us, don't ask the doctor to look into your eyes, because the doctor is far from you. Let's talk about general things, general issues that you may have heard discussed on the program. So let's, keep it straight, keep it simple, and together we'll have a great hour. In the meantime, in the between time, let's get into a little message for you. It's called Sighted Guide Technique.
Courtesy is a presentation of Persons Associated with Visual Impairment, Episode 1.
Gosh, boy, like we late. Let me answer on quick, eh?
Wrong seat, son, wrong seat.
Oh, gosh, man. When will you learn to guide me properly, boy? I tell you. When we enter a room, give me the heads up. Tell me how the chair is situated and guide me to one. Put my hand on the back of the chair so that I could check to make sure it's safe to sit down on the chair. Look how you make me sit down on you, man.
Me, partner, don't blame me now. It's you play Mr. Punctual and hurry to run and sit down. Anyhow, one good thing I could say, you will have the best seat in the room.
This is so embarrassing, eh?
Interesting and important message there about sighted guide techniques. As I said, we're discussing eye health and eye care. And to help us through the next couple of minutes will be Dr. Kumar, but he's not going to be talking first. We have Franca, who is the lady amongst us, Franca Mohammed. She'll be telling us all about CVRS. And we have Abraham Mohammed, no correlation, and he will be joining in a little while to talk about, low vision, etc. But let's find out about CVRS and its whole spectrum of activities in relation to Trinidad Eye Hospital. Franca, good evening. Well, Trinidad and Tobago time, welcome.
Thank you, Mr. Prasad, and thank you, Mended Studios, for having us. We're very happy to be here this evening. CVRS collaborating with PAVI to bring this message about low vision rehabilitation and services that are available to people with low vision. CVRS stands for Caribbean Vitreous and Retina Surgery Limited. And this company is an ophthalmology service-based company which has been open since 2011. The chairman of the company is Dr. Ronnie Bowler, and he's had a long-standing relationship with patients, offering retina surgery and a whole range of services inclusive of cataracts, glaucoma treatment, and so on throughout Trinidad and Tobago. However, it's a team of technicians, a team of doctors, and we have grown over the years. From 2011 to now, we've come a long way, expanding and really developing the quality of our service to the population. What we have been able to successfully do is open a not-for-profit arm of the organization, which is Trinidad Eye Hospital. And that is part of the reason we are here today, because education is one of the pillars of the Trinidad Eye Hospital, and really educating the patient population on services related to eye care is very special and important to us. So this is why we are here this evening, and we thank you for having us.
Now, you say that this is the non-profit segment, that is the sector, the Trinidad Eye Hospital. So then if you do little surgeries or provide technical aids low vision aids, whatever they are, who pays for them?
Well, that's the thing. CVRS has been very strong in the ophthalmology service area for many years. And in about 2016, we realized many patients come to us had difficulties affording some of the care. And as a result, Trinidad Eye Hospital was opened really to develop the charitable arm of service. So CVRS is actually the primary sponsor of the charitable initiatives that are run at Trinidad Eye Hospital. But quite recently, in 2019, we've been very fortunate to have corporate Trinidad and Tobago join in and add to that list of sponsorship for persons who require expensive eye care, corrective surgeries. And, we've been able to help a lot of people. Actually, since 2016, we've done about 158 eye procedures at no charge to the patient.
In terms of the waiting list, because I know, prior to CVRS coming on the scene, and even now you hear people talk about a long waiting list at hospitals, etc. The other day I was hearing, it's not too bad when you compare it to years ago. It's now 3 months for cataract surgery, etc. In terms of the waiting list for patients, is it very long?
Well, I do agree with you. I think there's been a lot of improvement in the public sector in terms of waiting lists and so on. However, we acknowledge and recognize that this is a multi-faceted approach to eye care, and all parts of the community need to be involved: public, private, not-for-profit, profit, for-profit. Like, everybody needs to be focused on getting patients the care they need. Specifically with certain eye diseases, it's very time sensitive. Like, so for example, the more complicated retinal surgeries, and Dr. Kumar will be able to say more about that. Mm-hmm. If patients wait too long, it actually impacts the level of improvement that they can actually receive. So if we are able to raise funds to get people the care that they need, they have a higher chance of getting a better result and retaining more of their vision if it is done in a quick fashion,
You based here in Trinidad. You carry a Caribbean name. In terms of service to the region, are you able to handle that as well?
Well, yes. Caribbean Vitreous and Retina Surgery was really established to serve the Caribbean. So yes, Trinidad and Tobago obviously is our home, but Dr. Bola always knew that patients in the Caribbean should have a specialty place within the Caribbean region where they can get the best eye care that they need. So we do have patients who fly in from Guyana, from Antigua, Grenada, St. Lucia, all over the Caribbean. And we do hold these patients very special because they have to make a lot of sacrifice to come to us. And in Antigua, we were actually very happy to sign an agreement with their Ministry of Health, where we go and we provide the service to Antigua in their public hospital. So Caribbean really is the right name for us because it really wasn't meant to solve a eye care problem in our country, but rather in our region and to anyone who actually needs the service.
Right. Well, before we close, because I know we have two gentlemen to come and talk about low vision and stuff like that, what are your final parting words to our listeners/viewers or viewers/listeners?
Well, as I said, Trinidad Eye Hospital is very passionate about eye care, but education in eye care is a big thing for us. And every platform that we have an opportunity to share information on taking care of your eyes, building awareness, talking about where you can access service and aids, it really is very, very important to us. And so to have this opportunity today to work with PAVI and to sit here and share information about low vision and low vision rehabilitation, it really is really a special moment for us. So we want to thank you again for inviting us, and we hope you enjoyed the information shared here today that Dr. Kumar and Ibrahim will share with you.
Okay, and that's the word from the lady. And when the ladies speak, the men have to listen. So after this break, we introduce Dr. Kumar and Mr. Abraham Mohammed. Well, we're back. Thank you very much. And well, as we indicated before the break, we had the lady who told us all about the operational side of things in terms of CVRS, etc. Now we have the two gentlemen who are going to discuss with us low vision, because this is one of the primary areas. Now, to my mind, low vision is being caught in no man's land, so to speak, because according to how you approach it, you either seen by others as playing blind, or you're blind, or you're not sure what to do, where to go, who to turn to. Let's talk about this low vision we have, as I said before, and in case you're now joining us, welcome to the Mended Studio platform, live stream, and we're discussing eye care and eye health. My name is Bawani Prasad, and I'm your host for this presentation. So, Dr. Kumar, I understand you recently came to Trinidad 9 months ago.
Yes, sir.
And I understand you're loving everything about it?
Absolutely, everything Trinidad. I love it.
Now it's too bad that you came just before COVID, because, you know, the lockdown has had a significant impact on the way we do things here in Trinidad. So even Diwali, which you might be familiar with in India, you know, it's a scaled down kind of thing. But we're not here to talk about those kind of activities. We're here to talk about low vision. Perhaps I want you're an ophthalmologist by profession, right?
Correct. Yes.
Right, and our very good friend at the end here, Abraham, you are Trinidadian,
Yes, yes.
right? And you are specialized in what?
I'm the optometrist at CVRS.
Right. So we have both an ophthalmologist and an optometrist. So maybe we can get in a nutshell. What is the difference? The ophthalmologist does what, Dr. Kumar?
Mr. Prasad, first and foremost, I would like to say it's a pleasure to meet you. Having heard about you, seen you on television when you've played blind cricket, I'm aware of you much before I've met you. So it's indeed my honor and pleasure to interact with you. And to Mended Studios and to PAVI, the organization, it's a pleasure to participate in this education program. COVID has definitely allowed me to stay back in Trinidad and not travel around the Caribbean, and helped me see Trinidad much more. So there are some benefits to COVID, actually. So I would like to look at it that way.
Okay.
And I think through this meet, which we have today, we want to bring out the aspect about low visual aids. But before we enter into low vision aids, we wanted to talk a little bit before about what exactly happens and who turns out to have low visual aids.
Yeah, but before we go there, just tell our listeners / viewers about the role of an ophthalmologist, because I want to come to Abraham after to talk about optometrists, because you know some people when their sight begins to fail, they prefer maybe cost factor and otherwise to say, well, look, I'm going by the drugstore, and I'm going by the optometrist, and I'm going by this one, and I'm going by that one, and I'm going to try this and try that. What is the role of an ophthalmologist?
Right.
And who is an ophthalmologist?
Okay. So as an ophthalmologist, I am somebody who has been to medical school, qualified and done my bachelor's in medicine and surgery, and subsequently trained for several years in the specialization of ophthalmology. And I've done this in England and got my fellowship in the Royal College of Surgeons in Edinburgh. Mm-hmm. And after that, I have worked as a consultant to provide care, particularly for diseases related to the eyes. And we work as a team with optometrists who allow us to provide care for people who have specific eye needs.
Okay. Well, that is establishing you, and I'm glad that this is a team initiative between ophthalmologists and optometrists. Who or what is an optometrist, Mr. Ibrahim Mohammed?
So an optometrist is a primary eye care practitioner of the eye. We pick up and detect diseases as well as screen patients for glasses, other optical services such as contact lens, low vision exams, other things pertaining to the eye as well. As Dr. Kumar said, an ophthalmologist would go through medical school. An optometrist, there is a degree for that. I did my degree in University of the West Indies in Trinidad and Tobago. And you got a Bachelor of Sciences degree as an optometrist.
Right. So there we have it, listeners and viewers. We have an ophthalmologist and an optometrist with us. Now we're going to look at low vision, the impact of low vision. As I said before, you know, some people have a little bit of vision, and some people still live in denial that they're losing sight, etc. So let's talk about low vision and low vision aids. Dr. Kumar, since you talk cricket, you want to open the batting with that?
Absolutely, I would love to actually. Although I was a one-down batsman in the local cricket team, but I'm quite happy to open the innings actually.
Good.
What we wanted to bring to the forum is any person anywhere in the world would present to an optometrist or an ophthalmologist with some kind of vision impairment. Otherwise, they wouldn't turn up to us. And what we tend to do is do all the necessary tests, identify what is correctable if it's feasible by the optometrist with glasses, or if there is intervention required by the ophthalmologist through surgery. Example, cataract surgery, injections for the back of the eyes, or if there is any retinal surgery. By this, we find that we are avoiding blindness, which is 90% of the times. When we cannot improve their eyesight with any intervention, we call an individual having persisting visual impairment. And that is where we come in and to say, now this individual who has attempted to improve their eyesight is left with impairment, but we need to ensure that they live independently, function independently in their houses and in the community and within the country. So we look for aids that might allow them to be independent.
Mm-hmm.
And that is where the low visual aids come into play.
Okay. That sounds very interesting in terms of the aids. Now, when you talk about aids, I know you have some slides. I don't know if you have them ready for that, but maybe you want to walk us through some of these?
So before I go to that, I'm just going to bring in about what is the situation with who are the commonest people who land up. I have some information from Trinidad and Tobago National Eye Study that was done.
Yes, I remember that eye study.
Yes, and we found that the main causes for blindness in Trinidad and Tobago are primarily not having glasses. Refractive error contributes to about 47% of blindness, and this is avoidable.
Mm-hmm.
Next one, glaucoma. Next one, cataract. And then the other one, not to be forgotten, is diabetic retinopathy.
Mm-hmm.
Avoidable visual impairment accounted for nearly 86 to 90% of people aging 40 years and over. Blindness prevalence in Trinidad is 0.73%, and moderate to severe visual loss is just about 5.34% in the age groups of about 40 years old. So by understanding the data from this study, we know that there is a definite problem. And the problem is about 5 to 10%. But these people who have impairment in vision allows intervention for restoration of functional ability, improvement of the quality of life, and independence in many walks. And allowing this to be done by my team member, Ibrahim, through a proper clinical and functional assessment for the patient's requirements and daily needs, and which is individually catered, is the most important thing. Here, I would bring in Ibrahim, who would take us through a little more about which individual qualifies to have low vision assessment and what is the aims of low vision assessment.
Great. So, Ibrahim?
Hi. So, who qualifies for low vision assessment? Anyone with a visual acuity worse than 20/60 but better than 2200 in the better eye after optical correction or surgery/treatment would qualify for a low vision exam. The aims of low vision exam. A low vision exam we want to try to improve a patient's quality of life, help them to regain their independence, improve their visual function, and also educate and counsel not only the patient but family and friends as well.
And this is where PAVI comes into play, because as the organization involved in rehabilitation, well, what we now call adjustment to blindness, the patients are referred to us, and then we take it through added counseling as well as working with the family and also retraining so that they could continue to live as independently as possible. So you see, listeners and viewers, this is why the team effort is extremely important. Now, I want to talk to you, Ibrahim, because I know people want to wear glasses. A lot of people wear glasses for fashion rather than for reality, because it might look good on you, but it may not be good for you. I'm sure you've encountered that problem.
Yeah.
So what do you advise them?
Well, wearing on glasses for fashion is not a bad thing. If someone likes it, they could. However, if you're wearing glasses for a particular problem, right, if you're not seeing properly, or nowadays with a lot more computer use, things like that, it's important to get a comprehensive eye examination so an optometrist could prescribe the proper glasses for you. You know, sometimes you would get patients who would go in the pharmacy and get an over-the-counter reading glasses, right? But that may not be the correct strength that they need for reading. So it's always better to get a comprehensive eye examination first for the optometrist to prescribe a glasses that is right for you.
I know that dealing with blindness or any kind of disability, that for that matter, there are a lot of people who live in denial. Have you come across with your clients, with your patients, that kind of scenario? And I mean, they tend to believe and say, well, look, somebody do this to me, or I wonder the doctor talking the truth, or, you know, they come up with all kinds, a million and one excuses. How do you manage to counsel them to say, well, look, you know, this is the reality, and this is where you need to go, this is how you need to go forward?
Yes, it's something that not only I encountered before, but I'm sure the doctors encountered it as well. And it's really talking to the patient as well as their family members. And the good thing about working so closely with ophthalmologists is that if I talk to a patient but they want a second opinion, they will talk to the doctors. And a lot of times when they hear the same thing from the ophthalmologist and the optometrist, it helps the patient to accept the fact of vision loss a little faster and a little easier as well.
Dr. Kumar, this whole question of low vision, I know for some people after 6 o'clock, when that, what we call the twilight hour, they're no man's land. They don't see a thing. You know, what do you recommend in terms of how we treat with that kind of situation?
It's very difficult to answer that question, not having experienced what exactly an individual goes through. Whatever I say is an opinion I'm giving, based on what I've heard from people who are having difficulties. So it's not a personal opinion, but this is an understanding a little bit. And to touch on blindness, it's something which hurts us in simple terms, because there are some things, and if you look at data that is available, a lot of it is avoidable. All we need is awareness of the fact that regular eye check can prevent blindness. But in spite of this, there are situations, no matter how you go about, you still, unfortunately, with various things attempted, you still are left with poor vision. And my particular story with this one is that a patient and his family, her family actually helped me understand this better by saying, Doc, I come to you, interact with you for 15-20 minutes, and then go away, and then I have my whole life to lead. And that is when it dawned upon me that my role as an ophthalmologist doesn't end in helping somebody sort a problem. But if there's an issue which we cannot sort out, how do I allow an individual to interact with welfare association or people who may know how better to help an individual to manage themselves in a surrounding where there is poor vision? Because I'm inexperienced.
Right. And this is again where an organization like PAVI, which provides the adjustment to blindness, comes into play to take the process forward and to ensure that that person continues living as near normal a life as possible. From an optometrist point of view, what kind of experiences you have encountered in terms of trying to convince people, look, you have a visual problem, but how do you treat with it and how do you go forward?
So firstly, when someone loses their vision, right, you would expect them to mourn for a period of time, and that's normal, right? Nothing is wrong with grieving for a period of time, but it's important to let the